Thank you, everyone, for the opportunity to join your important workshop today. In a moment, I'll share some slides, but before I do, I just want to share that my first part of my career was actually in primary care, health promotion, and working in community health services. So I'm absolutely delighted that we can have this conversation today around sustainable healthcare. And I'm here representing the University of Melbourne. For some of you that have visited us recently, the Lufthansa, that's down in the south of Australia. And we are a university that has a strong focus on climate change and health. I'm a climate change and health researcher, but like I said, a strong background as a practitioner working in the sector. And when I returned to academia, I was very interested in the nexus between climate change, equity, and health. And more recently, I've been focusing on sustainable healthcare, as well as, even more recently, focusing on digitally enabled sustainable healthcare. So what I want to do is share some of our experiences, challenges and opportunities in the Australian context, and then perhaps leave off on a couple of points about this nexus of digitally enabled, climate resilient and sustainable healthcare. So let me just go ahead. All right, I think I'm probably amongst colleagues and friends, both working at the front line of climate change and health impacts, as well as potentially having your own lived experiences of the impacts of climate change on human health. And we know that the impacts of climate change on health are ubiquitous, and there's multiple drivers of health outcomes, disease outcomes, climate-sensitive disease, as well as increasing body of evidence around the mental health and wellbeing impacts of climate change. We also know that climate change is exacerbating existing inequities. So that's our starting point, that the science is in, we're very clear that climate change is impacting health, and health professionals have an important role in both adapting communities and health services to climate change impacts, both now and into the future, as well as mitigating the impact of climate change, of their impact. In Australia, we are focusing our efforts on mitigation and trying to ensure that we're not delivering healthcare with a lot of carbon emissions and pollution. So let me tell you briefly about the impacts of climate change on the Australian population and health systems. And here are just 3 examples of extreme events that have occurred in recent times within the past decade or so in the Australian context. And we have evidence for death, injury, illness, as well as the impact on the health system. On the far left, heat waves. We have research that demonstrates that there's excessive death related to our heat waves in different parts of our country. Also, we have data that shows the impact or burden that is on our emergency systems. An increase of 46% ambulance call-out in one event, in one heat wave in one country. An 8-fold increase in emergency department attendances, as well as an increase in death on arrival. You may be aware of our bushfires and the significant bushfire impacts that we're experiencing here. One of the most notable is the 2019-2020 bushfires that affected the whole southeastern seaboard of Australia, where most of our population resides. And we have really strong evidence to demonstrate the smoke health burden. Set aside the direct death and other outcomes, but just from smoke health burden, an increase in death, CVS admissions, respiratory admissions, as well as asthma. And then more recently, we're faced with floods and storms. And here is just a couple of examples of where our hospitals in regional settings have had to be evacuated owing to storms and floods. And it was only about 6 months ago here in one town in Australia, within the space of 3 days, they went from a heat wave to the bushfire to floods. So the impacts are cascading, they're real, urgent, and our health systems are carrying the burden of climate change's impacts. Here's an example from one health service or hospital in our context, which demonstrates this link between climate change extreme events and the outcomes for our health services. So what we find when you correlate our Bureau of Meteorology records for that 19 years between 2000 and 2019, we will have a 15% increase in emergency department presentation on hot nights, which is about 9 or 10 extra patients during those periods. And whilst that may not sound like a lot, our health systems, contrary to popular understanding of the Australian health system, are quite full up already. They're already under pressure and they're under-resourced. And we do have a health workforce crisis here in Australia. So those extreme weather events create burden on our health system. Also, what we find is not only the day of exposure, but it's up to 3 days after the exposure that we have an uptick in admissions and therefore an increased presentation within our context of our health systems, both in our urban settings as well as our regional and rural settings. So let's get into this nexus now between the climate change impacts, which is worsening climate change, which is over on the left-hand side of this diagram, is increasing health and disease impacts. We're clear about that. The evidence is in, and those lived experiences demonstrate that. The other part to this, and which is the paradox that keeps looping back in on itself, is in the Australian context anyway, and many other high-income and emerging economies, is that healthcare also has high carbon emissions. And as you probably know from your own research and experience, if healthcare was a nation, it would be the 5th largest emitter globally. And in the Australian context, that's certainly true. 7% of our of our national emissions come from the healthcare sector. So we're stuck in this virtuous cycle of worsening climate change, health impacts, driving up the need for healthcare, and then feeding back into the worsening climate change problem. And so we know as health practitioners and health academics that part of our ethics is to do no harm. Therefore, it's our responsibility as health service providers, managers, clinicians, non-clinicians, advocates, that we need to get our house in order and be a part of the solution, not generating the problem. So the Australian healthcare carbon footprint, like I said, 7% of Australia's total carbon footprint makes up our national analysis. And what you can see here is it's largely related to public hospitals and private hospitals, as well as pharmaceuticals, as well as the other day-to-day operations of our health system. And the author of that paper, Forbes McGain, actually works with the University of Melbourne, and he's our Dean of Sustainable Healthcare at the University of Melbourne. You may also be aware that in terms of footprint, there's put 4 fingers up, 3 types of parts to footprint, and they're called scope 1, 2, and 3. So in terms of greenhouse gas emissions, if you look on the second column, 17% of our greenhouse gas emissions, particularly in the Australian context, but usually in other high income and emerging economies, is from direct emissions. So the facility, the hospitals' emissions and their vehicle emissions. The second greenhouse emission profile is scope 2, and that's about 12% of emissions. And we call that indirect emissions resulting from their energy consumption. So in Australia, we often purchase electricity, steam, heating and cooling. We don't generate it on site, and therefore we're actually consuming emissions that are fossil fuel driven. And then finally, the third scope area actually constitutes quite a significant proportion of the footprint, and that 71% is scope 3 emissions. And that's all the other emissions you saw on that pie diagram on the previous slide. And that is all of our consumables, transport, pharmaceuticals, the waste, and our patient commuting. So it's quite a significant part of our footprint in Australia. I'm very keen to hear more about the Indonesian context, but I'm only able to speak about my local context here today. So that's the breakdown of the emissions, and Australia is doing a lot of work in terms of mitigation because we have a high footprint. So if you're wanting to understand where the public hospital energy emissions are and what the breakdown are, you can see that Victoria, which is on the far left and where I live, has a high level of electricity use from brown coal. And the blue part of that is gas consumption of the Victorian system. And down the bottom is this tiny piece of green, and that's the proportion of renewable electricity that we use in the Victorian context. So Victoria has a fair way to go in terms of changing its energy composition. And later in the presentation, I'll tell you about the good news. And then you can see the other states and territories, which roughly also equates to the population profile of Australia. But just to say that public hospitals in Australia, on average, are equivalent to about 630,000 average households, and we have low levels of hospital renewables at this point in time. In terms of getting down to department level, here is one study of septic shock emissions into ED. And so where do the emissions come for one day for a particular type of profile of sick patient? We know in the Australian context, most of the footprint comes from heating and cooling, which is a large amount for treating septic shock. And these are the times of the year. And it mostly comes from electricity and gas. And down the bottom, you've got the other sources of CO2 emissions, such as plastics, rubber, laundering, and other items. So septic shock, one type of emission, one type of ICU, which is intensive care unit. You probably use the same acronym, so we can see that the emissions are high. However, let's get quickly to the good news in the Australian context. We know that healthcare can be a very big part of the solution. For example, in healthcare's reach is significant in Australia. It's more than 10% of our GDP. We employ more than 1 million Australians, and to consider that we have 27 million Australians, that's quite a large sector. So we have a lot of people that if they act sustainably at work and in their personal life can actually be a part of the solution. We also have a massive influence on our supply chains because we're major producers and purchasers of goods. A lot of food goes into our hospital services, upwards of $185 billion. So our choices in that supply chain can have a massive impact on the emissions related to food. We're very large estate holders and developers, and we own lots of sites for the country. So our decisions in the context of healthcare in Australia can have a significant impact on emissions profile. How am I going, Luftan? Good? Yep, I'll keep going. You're connecting to audio. All right, so what is the good news in the Australian context? Well, we have very clear mandates from government about our trajectory for renewables, and this is both top down from the government, but also bottom up. So many of our health services have seen their responsibility and are building, when they are either retrofitting existing hospitals or health services, or they're building new services, they are going all electric, 100% renewable electricity. So that's really exciting. And that is often a combination of purchased renewable energy, rooftop solar, biogas, and other forms of renewables. And so here's just some of the examples of the hospitals we're starting to build or which we're starting to retrofit in Australia. Now, this might make some of you laugh, and because it might go to a stereotype about Australia, but this hospital is biogas and it's powered by beer. So in Australia, you might hear that there's some people that are quite fond of beer. And so we actually use the factory sources of emissions to use the biogas to drive this particular hospital. So we're using multiple pathways for driving our health services and therefore lowering emissions. So they call this the beer and cheese hospital because it's powered by the local industries. All right, so what are our decarbonisation priorities for the Australian context, which were largely identified by leaders in the field, the NHS England? So our priorities here are shifting to sustainable models of clinical care, which also have implications for digital health, as well as preventative and primary care. And I understand from the introduction that many of you are working in the preventative primary care space. So we share the priority of sustainable models, as well as focusing our efforts on prevention and upstream care and keeping people out of hospital. Decarbonising our supply chain so we don't have to bring in products and services with high emissions. We're also trying to decarbonise our healthcare facilities and operations. There's been a lot of work here on medical gases, including nitrous oxide. And one of my colleagues at the University of Melbourne wrote the Federal Department of Government guidelines on reducing nitrous oxide leaks, which was constituting 80% wasn't getting to the patient. It was leaking before it was getting to the patient, which has implications particularly for birthing suites in the Australian context, as well as getting emissions down in terms of staff and patient transport. This may also resonate for you, and that is low value care. In the Australian context, it's thought that 10% of our care is actually harmful care and it shouldn't be applied. 30% may be low value care that is actually not contributing to health and well-being and is not necessarily like over testing, and which eventuates in more than 11.5 million tonnes of carbon dioxide. So there are some opportunities in terms of reducing harmful care that's not required and or is contradictory to the needs of the patient, as well as low value care like additional testing, unnecessary services. So that's another part of our priorities here in the Australian context. And one really good example of that is metered dose inhalers. Metered dose inhalers is equivalent to driving a car 300 kilometres, where a dry powder option gives the same clinical outcomes without the pollution and greenhouse gas emissions. I'll keep moving just because I'm quite aware of time. How am I going, Lufthansa? Can you hold up fingers for how many
About 3 minutes left.
Okay, great. All right. So some of the things that have been happening in our context that may be relevant to the work that you're doing is that all of our medical and health peak bodies banded together to advocate for the majority of emission cuts by 2030 and have a net zero system by 2040. I don't personally think that's ambitious enough, but we appreciate there's a lot of work to do. We also now have a national climate change and health strategy at the federal level. We have a national sustainability healthcare unit that's helping us to drive these changes, as well as education systems and curricula to help health and medical practitioners know and understand the risk to health as well as their responsibilities for actioning change. Now, acknowledging the topic that you're now focusing on, I just want to make a few final remarks before I hand back. It's fairly well reasoned that digital innovation and data science can contribute to the sustainable healthcare agenda. However, there are opportunities and challenges, more on the challenges side, that we need to consider before we run headlong into digitising for the sake of sustainable health outcomes. I think we need to keep in mind, the challenges, that there's hidden environmental impacts of digitisation. So the energy required to generate and process large amounts of data, the impact of the material on the environment from data centres, that there's an unsustainable extraction of minerals for technology, and that we often end up with a lot of e-waste. So I think we can largely agree that digitisation is a great opportunity for sustainable healthcare, but we must keep in mind front and centre that there are these environmental impacts, and we need to keep them inside of our assessments as we develop our frameworks and opportunities. Now, I've just compiled here, and I'll pass these on over to Luftan in due course. These are some of the opportunities that I imagine you'll explore in the workshop of digital healthcare and sustainable practices. And many of these go to lean digitisation and innovation and data science, and being very aware of those environmental impacts that I highlighted just previously. So I'd just like to land on this proposition. We're doing some work here between the Centre for Digital Health Innovation as well as Melbourne Climate Futures on two transitions, which is sustainable healthcare on the one hand and digitally enabled healthcare systems in innovation. We believe bringing them together, there's lots of opportunities for efficiencies, quality improvement, and health staff and patient wellbeing and satisfaction. So we're currently working on a thought leadership piece that goes very much to this notion. If you're interested in some of the work that we're doing here at the University of Melbourne, look no further than Anne Border's research as well as Kathleen Gray. I'll leave it there. In the interest of time, I'm so pleased I had an opportunity to join you, and let me know if there's any questions or anything I can pass on.